overview of the MediKeeper Health Assessment found within your Live Life Well Wellness Center. The purpose of this particular health assessment is to give you a more customized experience within the system by assessing and the identification of potential health risks and ultimately health topics you may simply want to learn more about. So, first and foremost, to access this health assessment, you'll want to log in to your Live Life Well portal. And that can be done a multitude of ways. You can either go direct by visiting livelifewellmt.medikeeper.com, seen at the top of my screen, or if you are an employee on the state of Montana's network, you can simply log in via single sign-on at your benefits page. So once you're logged in, you will want to scroll down till you see this tile labeled Health Assessment. So you can see here, it's going to take you to that first question. You're going to see the various topics that will be covered across here. And basically what you want to do is you're going to want to go from question to question. The system will automatically take you to the next question, to the next session as you progress. You cannot skip, but if you decide you want to take a break, something pops up, you can always hit save and quit. So when you come back in here, it'll take you back to where you left off. So as you can see here, this first question is already self-populated, and this comes from various information we may receive from the eligibility file. And in addition, if you already completed a state-sponsored health screening, if we receive those results, you will also see those throughout this health assessment. So you'll be able to click continue. Again, just update as you see fit. We're just going to click continue. If there is a question that you can skip, you will see that option populate in this same section next to continue. So if you're not sure about this, if you're of Northern European descent, you can click skip question. If you want further information, maybe as to why this is being asked, the details, it's going to tell you that the descent from United Kingdom, Scandinavia, and North Germany. So I'm just going to click skip question. As you'll see, this was already pulled in based upon screening results that were received, so we can click continue. And again, feel free if any of this seems a bit off, or maybe something's changed since you last had your screening. Maybe you lost a little weight, gained a little weight. You can absolutely update that as you see fit. Now, some of these questions do get very specific, but there is always a reason behind it. We ultimately know individuals that may have a natural red hair color, may burn more easily. And so based upon how you answer some of these questions, there's an algorithm that's going to determine maybe what additional questions may need to be asked. Some of the information and questions that are asked could feel a bit intrusive, or you may feel a little uncomfortable answering, but just rest assured, anything that you provide in this health assessment will not be shared with anyone, including your employer. This is something that is simply for you to provide additional education and resources to guide you on your path to your wellness journey. All right, so once you've completed that health assessment, you are going to receive a report that's going to show your risk for disease based upon the information you provided within the health assessment. It's going to give you a graphical depiction, green showing healthy, orange showing borderline, and red showing unhealthy. As you scroll down, you're going to see each category of disease listed on the left-hand side, but it also goes in order. But should you like to skip around, you 100% can. You can click here and it's going to take you to that appropriate section. You'll see here there's a graph that is showing blue, and it's simply because you did not provide enough information for the system to evaluate your true risk. This may be because of some questions that you were able to skip. Maybe you opted not to complete a section. If you ever decide that you might like to see this information, you can absolutely go back into your health assessment, make updates, and have the system recalculate your risk. But for those that you do have risk populated, you can click on the pluses and determine ways that you can reduce your risk. There are definitely ways that you can change your risk factors and ways that you cannot. But with that, we also provide information on ways to reduce your risk. So by clicking here, you can click Learn More, which is going to take you to a Plan for Wellness program focused on reducing your sugar intake. So if we click here, it's going to immediately pop us in here. And Plans for Wellness take 3 days to complete. It's going to go over that specific topic to help guide you and ultimately hopefully lower your risk associated with the disease that you are at risk with. I hope this webinar was beneficial and educational, and I hope you all take part as you continue this journey with your wellness program. Thanks so much. Have a great day.